Hey everyone, it's Ed. Super excited for another edition of Ed Talks. And it's always the most fun when it's someone that I've been friends with for many, many years. So Dr. Cole Edmonson, welcome to Ed Talks.
Thank you, Ed. It's a pleasure to be here. I'm looking forward to our conversation.
Yeah, Cole, you and we served together at Texas Health Resources from, I think we were overlapped 2010 to 2015. So we had a good 5 years together. You were such a breath of fresh air. I've always loved nurses and you were just amazing. I know you stayed even longer after I left. You just did so much for the organization and representing all the nurses, giving nurses a voice, and just being a great leader overall outside of nursing, just for the whole institution organization. And so I've always admired you. So it's kind of fun to have you on my show.
Back at you, Ed. I think in many ways we have both been blessed in our careers, and we did have that time together. So great people have a way of finding great people in the world over and over again.
Very true. So I want to also talk about nurses on boards, because you have an amazing career and you made a switch in the past year to nurses on board. So tell us about that. Like how did that come about and why did you go and become the CEO of Nurses on Boards?
I love the organization. I came to Nurses on Boards Coalition for the mission, which is really to improve the health of communities through the service of nurses on boards. I've had a really wonderful connection with them for the last 10 years. They're celebrating their 10th year and a decade of impact. I was on the original Nurses on Boards Coalition, appointed by Sue Hassmiller as an action coalition lead. So I got to know them from the very beginning, to be forming a 501(c)(3, to getting our original board together, doing our bylaws, our committees, our national work groups, and then really being there as well for the first strategic plan. But we were really created out of the Institute of Medicine's Future of Nursing report in 2010. That looked at the fact that nurses really needed to have equal influence with physicians on the transformation of healthcare. So how did we do that? We needed to form a coalition of the national nursing organizations. So 21 national nursing organizations came together to found the Nurses on Boards Coalition, and all looked to see how we could set a very, very lofty goal, which was let's get 10,000 board seats filled by nurses by 2020.
And I think you did, right? You at least have registered over 28,000 nurses, and over 11,000, it's probably higher since I did my research, 11,000 sit on boards. And you have another 15,000 or more like waving their hands like, hey, I'm ready. I already want to
That's right.
Yeah.
And then we also have another 5,000 that are in the database that they actually want to serve on an additional board. So they've had great experiences and they want to serve on another board to really continue to influence and impact health. And when I look at those statistics, and what it tells me too is that this is really not a supply issue. This is a demand issue.
Yeah.
So how do we help uncover or create or discover more opportunities for nurses to serve on boards and other entities? And when we look at a board, we're thinking about more just a governing body that has influence and impact on the strategic direction of an organization. And that could be anything from your local PTA board to an AARP board at the state level to a private company or publicly traded company board. So we really see that nurses have the opportunity to influence across all industries, as everyone has a workforce and wants them to be healthy. Everyone wants to have a healthy bottom line. And my belief is nurses are good for business and nurses are good at business. And they have the opportunity not only to influence the health outcomes of the organization, but they also have the opportunity to help influence other outcomes that the organization is wanting to achieve.
Yeah, no, I love it. I'm a big proponent of nursing, obviously serving in healthcare myself and understanding I always say where the healthcare rubber meets the road is all about nursing. And I married a nurse, of course. And so I'm a big proponent. And you're right. We need nursing representation, not just in healthcare. And I love the fact that Nurses on Boards is healthcare for sure, but beyond healthcare, because there's something in the training that nurses receive. And also, I just think in the empathy, we need more humanness in all types of industries and organizations. And I think by and large, nurses are sort of drawn to the profession. They sort of have this empathy, right? They care about people and trying to help people in oftentimes during their deepest needs. So it's very cool. Yeah, tell us about that whole journey, sort of the future, where you're headed with Nurses on Boards.
We're really excited to be celebrating our first decade of impact and then thinking about our second decade of impact in the Nurses on Boards Coalition. So we're actually in our strategic planning year and getting ready to redo our strategic plan for the next 3 years. And then we're going to cast a vision for 2050. that is really big and bold and courageous. And, I have served on a number of different boards myself. I was a part of one of the founding organizations, which was actually Nurses Everywhere, where we went and actually engaged a company to be able to go out and poll the public and ask them what is their opinions on nurses serving on boards, and should nurses be more influential in the transformation of healthcare. And 85% of the public said yes. We want nurses at the table having influence and impact as we're transforming healthcare. It's not only nurses that want to make sure that we have a place at the board level to be able to have voice, influence, and impact, but we also know that the public wants us to be there and to help support that transformation because of exactly what you said. We have holistic training, we're humanistic, we have experience not only in clinical outcomes, but also in quality and strategy and business and finance and human resource experience as well. So we are the largest part of the workforce, over 5.3 million nurses in the US and over 22 million globally. So where do we want to go in the next 3 to 5 years? We want to see how we can help nurses in other countries as well. So thinking about how internationally we can support nurses in their goals of serving on a board. We actually just did our very first engagement with the Kenya Nurses Association. So we're really excited about the opportunities to use a global health framework, be able to expand these competencies internationally. And then we also know that there are a lot of other healthcare professionals that are sitting at board tables and in strategic advisory groups as well. So we think that governance is not only for nursing, but for every healthcare professional that wants to serve. So being even more interprofessional.
Yeah.
And, we've done the latest research about a year ago on the impact of nurses on boards. And now we want to deepen that research to even start to understand more about the experience of nurses on boards, the influence on the different outcomes with organizations where they're serving on boards, and then be able to tell those stories in a very, very inspiring and inclusive way so that every nurse can see theirself serving on some board.
Yeah.
And being able to have the influence and impact that they want. Because for many nurses, this is a dream. So we see ourselves as well as dream makers and helping people to connect up with that passion.
I love that. And I'm just thinking to myself, I serve on a few boards. And if I just think about the healthcare ones, it's very traditional still. So I'm glad with Nurse on Board, you all have made such an inroad already and will continue to do so per your plan. Because I just think about, and nothing against these boards, obviously I'm not going to mention their names, but I just think about, we have finance people, we have lawyers, we have different community people, but it's like, where are my clinicians? Where are my nurses? And that's where the action happens. And they bring this perspective that, no, we want the lawyers for sure, right? Because you need that legal guidance. And we want the finance people because we need the financial acumen and things like that. So it's not disparaging any other group. But we also need right there, hand in hand, shoulder to shoulder, our nurse colleagues for sure. And so I've been pushing on those organizations that I'm part of, like, where are the nurses? Who's the nurse? And so change is there. And like you said, you all have already made great impact, not just locally in the United States, but I know also in the Philippines. And you mentioned sort of that international perspective. So that's great. So Cole, if I'm listening, I'm a nurse, or maybe I'm not even a nurse, but we'll just stick for nursing for right now. If I'm a nurse listening, it's like, oh wow, I maybe I didn't realize I could be on a board. How would we activate them? How could they get involved?
The best way is to go to our website, nursesonboardscoalition.org. You can sign up to be counted for the boards that you are serving on. And then you can also sign up to say, I want to be on a board. And then that gets you into our database that you mentioned that has just under 29,000 nurses in it. And then that allows us also to send you our newsletter. It allows us to send you the board placement opportunities that we're working on. And so far this year, we're working on 7 of those. And since about 2020, we've actually helped place over 200 nurses on different boards. So we have tremendous opportunity there to be able to engage. And that's the best way to get involved with the coalition. Secondly, as I think about it, what I want to make sure is that nurses know about the resources that are available to them on our website. Because originally it was about understanding the service of nurses on boards and in board seats. And then it became about preparing and supporting nurses that wanted to serve on boards or were serving on boards. And then we moved very quickly into needing to understand kind of the impact of nurses on boards to be able to tell those stories, to help inspire folks like you to think about, let's put a nurse on our board. Where are they at? Why would we not have a nurse on our board? And then the other piece is starting to do the research around thinking about how can we actually help do placements, create that demand, uncover that demand, discover that demand that's there, and maybe even help folks think differently about what a nurse could bring to your board.
Yeah.
So as we go into that, I'm also very, very aware that a lot of nurses tell us that they don't feel confident serving on a board. They don't always feel competent serving on a board, and they don't always feel comfortable in the setting. So things we've asked is, what do you need to do that? And it is preparation. I want to learn the art of governance. I want to learn the finance language, and I want to make sure that I have the right time and I understand the commitment to be able to serve on a board. So I want nurses to serve confidently, competently, and comfortably when they're in that boardroom, because they will make a difference.
Yeah. No, I love that, right? Because it's one thing to be like, oh, yeah, I would love to be on a board. But yeah, what could hold us back is like we may have self-doubt and realize we don't have the tooling. I'm not sure. You all provide that. That's amazing. I'm going to put all this information in the show notes so that we can activate all these nurses to really get engaged. Because I think that's another way that we're going to transform healthcare is not just technology, which I love, and you do too. You've always were a great advocate and partner with me, but getting nurses involved on a governance level. Well, you're an amazing clinician, amazing person, amazing friend. Thank you for being my guest on EDTalks.
Thank you, Ed. It's been an absolute pleasure. Great to see you again, and look forward to connecting with you again soon. And thanks for all of your support of nursing. And just everyone know that Nurses on Boards Coalition is not only for nurses, it's for everyone.